All right. So the trigon is this triangular area made up of a smooth muscle called the detrusor muscle. So the detrusor muscle is what contracts when you are trying to urinate. All right. It's in this region. Uh, and this trigon is surrounded by the openings for your ureters. Your ureters open here in the trigon region. There's your urethra, and the urethra is surrounded by the external urinary diaphragm. So when you're trying to hold urine, you will contract the external urethral diaphragm and hold back urine. Okay, some things that we can see here. All right, so some differences between the male and the female urethra. Obviously, the male urethra is much longer, the female urethra is much shorter, which means what? Who gets UTIs? Females are more likely to short urethra. That is one reason for why they are more predisposed to that. So something you need to keep in mind. The male urethra, on the other hand, is quite long, much longer, okay? And so that is something that you can see. This is the female urethra, much shorter, as you can see, and the male urethra. It has three different portions: the prostatic urethra in between the prostate glands, the membranous urethra, which passes through the urogenital diaphragm, these muscles here, and then the much longer spongy urethra, which runs along the entire length of the penis. So you can see that the urethra is much longer here. This part is important, the prostatic urethra. Why? Because in a majority of males with age, the prostate gets larger in size, something called BPH, for benign prostatic hyperplasia, and that will put pressure on the urethra here, close it down, and so you're more likely to have UTIs, urinary tract infections as well in men, all right, because of that. Kidney stones, who gets it? If you are dehydrated, again, more likely to have kidney stones. If you eat a lot of meat, uric acid stones are more common, cholesterol stones are more common, calcium stones are common. So these are your risk factors. If you don't drink fluid a lot, right? Inadequate fluid intake, reduced urinary flow. Who else? People with BPH, again, benign prostatic hyperplasia, higher chance of developing kidney stones, okay? How can you treat kidney stones? You can do a ureteroscopy, right? Put in a ureteroscope and remove the stone, or you can do a lithotripsy. Lithotripsy is simply using high frequency sound waves to shatter those stones. All right, so focus sound waves and shatter those stones. All right, micturition reflex. Obviously, when your urinary bladder fills up with urine to up to 500 milliliters of urine, stretch receptors feel it, and then trigon muscle, the detrusor muscle starts to contract, you relax your urinary sphincters, and urination takes. It's a spinal reflex. Look at that. It goes to the spinal cord. All right, that's a micturition reflex. Okay, you can override your micturition reflex after 18 months of age. So you learn how to control, not to bed wet, in other words, right? Children do not have that. So okay, UTIs, urinary tract infections. We talked about some of the risk factors: diabetes, BPH, right? Being female, all of those things, and different types of urinary tract infections: urethritis, cystitis, pyelonephritis. This is the least serious. It's confined to the urethra. This is a little bit more serious because it has gone up to the urinary bladder. Pyelonephritis is the most common because here your kidneys are actually involved as well. Okay, so how would you treat this condition? Of course, antibiotics, and remove the cause of obstruction, cause of urinary obstruction. If it's stones, if it's BPH, you have to remove the prostate gland, you have to remove the stones. All right, incontinence. Who gets incontinence? Pregnant women do. People who have had prostate surgery, they do. All right, people with overactive bladder, childbirth. After childbirth, this is common too, or certain medications like diuretics, obviously, will cause incontinence. Okay, so treat the underlying cause. Retention, failure to urinate, again, BPH. Interestingly, benign prostatic hyperplasia, spinal concussion, a spinal shock, any injury to the backbone, and then urinary retention. So that might be what a catheter. Yeah, put in a Foley's catheter for that urination. Okay, let's stop with these questions. What characteristics are used to describe urine? Color, smell, pH, specific gravity, right? What conditions cause variation in pH of urine? What you're eating, meat eaters versus vegetable eaters, as an example, right? The doses, diabetes versus normal. What are the major components of the urinary tract? The kidneys, the ureters, the urinary bladder, and the urethra. what tunics are found in each of these, the same layers, mucosa, submucosa, right, muscularis, and the outside one. How do the urethras of a male and female differ? The male urethra is much longer. What steps lead to micturition? The filling, the stretch reflex, and then the relaxation of contraction of the detrusor, relaxation of the urinary sphincter. Okay, so done with chapter 26 as well. We still have chapter 27. Now, as Nadu had requested, I will extend the timeline for your homework. That's chapter 26 and
25 and 26 on the conic quiz. Conic.
Oh, connect quiz.
That's a practice.
Just send me a quick email, all right? Email me at my Gmail account again, my TCCD1, and so I will do that for you.
I email you already, but I don't know.
Okay, try one more time, and other students can try. Me too. You guys are getting my responses from my Gmail. Again, not the TCCD one, but the one with the my TCCD one. All right.
So let me repeat. It's a fuad.can@tccd.edu, right?
At my.tccd.edu. There should be a my.
Oh, at my.
There you go.
Oh, okay.
Yes, I'm receiving the my ones. So send me at that one.
Okay, I'll do it.
All right, and then keep an eye out for emails from me. I will be sending out the recordings, hopefully, and the whiteboard picture and study guides. I'm working on those too. Any other homework, like study modules, maybe for chapter 20, which one did we not go through? 26, no, 25, right? Chapter 25. I might assign that too, and then go over some of the important points. For your labs, do not forget to turn in your the pre-labs to unit 24-25. Pre-labs from your lab manual, unit 24-25. That would be for your lab quiz grade.
Mr. Ken?
Yes.
Can you send an email to the people that send you the pre-labs to make sure you get them? Because I send them to you, but I'm not sure if you get them or not.
I did get those from you, Claudia, and I'm replying. You likely sent it again at the TCCD one. I am unable to, I mean, you're not getting responses from me there. If you send it to my Gmail account, even though I have yours, so I can see it, but you're not receiving my responses from there. My responses you can receive from my Gmail account. So if you use with my TCCD one, I will be able to, you will be able to see my reply. But I did have yours. So if you're sending it to my other account, I have those. You will simply not get my responses from me.
Okay.
All right. Okay then. So everybody stay safe. Have a great weekend, rest of the week. Keep up with the good work, the study guides and everything. And email me. Let me know if you have any questions. All right.
Thank you.
Bye. Thank you.
All right.
Bye.
Bye. Have a good one.